Hello and welcome. My name is Enrique Hasso. I'm the director of the Texas Medical and Dental Schools Application Service, or TMDSAS, here in Austin, Texas. We're housed in the Texas Health Education Service office. Joining me today, we have 5 colleagues from around the state. We're covering every corner of Texas today, so we're really excited that they've taken the time to help share some insights with you all. Of course, this is a live Q&A, so we're all live here. We can snap our fingers and it's happening in real time. So if you have any questions for us, send them via the chat on YouTube. We do have a small pool of questions, but before we even get started, I'm going to ask each of you to introduce yourselves. If we could start with Dr. Calloway, then Dr. Kennedy, Ms. Lynn, Ms. Dubuque, and then Dr. Perry.
Hi, everybody. So nice to be with y'all today to help you along the path. I'm Judy Calloway. I'm the Associate Dean for Admissions and Outreach at the Long School of Medicine in San Antonio, Texas.
Good afternoon, everybody. My name is Mike Kennedy. I am Assistant Dean for Admissions at the Texas College of Osteopathic Medicine at the University of North Texas Health Science Center at Fort Worth.
Hi, everyone. My name is Amanda Lynn. I am the Director of Admissions for the UT Tyler School of Medicine. We're located in Tyler, Texas.
Hello, everyone. My name is Nicole Dubuque. I'm the Director for Admissions and Student Affairs at McGovern Medical School at UT Health Houston.
Hello, everyone. I am joining you from El Paso, Texas. Cynthia Perry. I'm the Associate Academic Dean for Admissions for the Foster School of Medicine.
Great. Thank you all so much for joining us and taking the time out of your schedule to answer some questions from our applicants. Looking around the room, I was thinking to myself, which school has the longer name? I don't know if it's the University of North Texas Health Science Center, Texas College of Osteopathic Medicine, or the Texas Tech Health Sciences Center at El Paso, Paul Foster School of Medicine. Miss Lynn, UT Tyler School of Medicine, I think wins for the shortest. So well done. All right. So as we kind of kick off today, I do want to ask one of the big questions that we often get. What are some key components of a successful medical school application? And we can free for all or raise your hand and I'll feature you so you can answer the question. Nobody's brave enough to take that one yet.
I'll get us rolling. I think so. I love the personal biography and looking at what you have done along your path. I think that's where we see where your strengths are. They could be in different areas. You could have lots of work in research or leadership, any of the components, right? Healthcare, community service. So that's my favorite part. I think a key thing is to tell us about the meaningfulness of each activity so that we understand what you got out of it, the lessons learned, how you grew, and that sort of thing.
Thank you. That's a great way to kick us off today.
Yeah, I definitely agree with what Dr. Calloway is saying. One of the things that I always try to tell students is don't assume the admissions committee will know what your activities were based on a title or based on a very short description. Use the spaces that you're given within the application to really share your experiences and what it meant for you and how you think it will make you a better physician or wherever your career path leads you.
And then can I also add, so we have a secondary application. I agree with everything both Amanda and Dr. Calloway said. For me, I really enjoy the secondary application when students are very open and honest on those responses, and even the optional essay. Like, I want to learn more about you than what you've put on your application, so don't restate your personal statement. But when they get that true insight to who they are kind of outside of medicine, what their journey has been.
Great. I realize I jumped the gun. I was supposed to ask you all to give us a quick elevator pitch for your school. So my apologies that we're going slightly out of order. So let's go in the same order that we introduced ourselves, and I'll allow you all, let's say about a minute. Let's say you ran into your chancellor and you get an opportunity to promote your school, or a prospective student. I'm sure we've all done that drill. So we'll kick it off with Dr. Kellaway.
Okay, I can't do anything. I can't do any answer in 1 minute. But anyway, I gotta say, San Antonio is a wonderful place to live. It's a very diverse community. We're a majority city, and so I think that gives us a special environment in which to work. The school is a modernized curriculum, Oregon system based, with great opportunities for individuals to do whatever it is you want. We're a big class and a big institution, but that gives our students lots of opportunities in all kinds of areas, not just medical specialty areas, but in the kind of career you want in medicine, academic or rural or a subspecialty, that kind of thing. So we have a great Center for Medical Humanities and Ethics. It's busy doing good in the world all over the place, and I'll stop there. So, or else I can go on for an hour. So.
Well, thank you. Dr. Kennedy?
Yeah, well, I hope I do a pretty good job of this because since our chancellor is an alum of our school, so I better not make a mistake. But we're pretty proud of what we've been able to do at TCOM. We are an osteopathic school, so that does make us distinctively a little bit different in the approach maybe that we're teaching clinically in a DO school. But so we're proud of that heritage, that we were the first DO school in the state, and we've graduated over 4,000 alumni. We're pretty well known to be a primary care school, but I'll be honest with you, we have graduates going into over 70 different specialties or subspecialties over the years. So our graduates are branching out, doing all sorts of amazing things. Like San Antonio, we are kind of a large class, so about 230 students, but we pride ourselves on being a small community of students. The campus culture in terms of the intimacy of, so to speak, of all the students getting to know each other and supporting each other really kind of feeds into that. The faculty have a strong dedication to teaching. It's always been a cornerstone of our school since the first day it opened. And we're really proud, and we're in a great city with a lot of wonderful hospital partners. I'll leave it at that.
Thank you. Amanda?
So for the UT Tyler School of Medicine, we're a very brand new program. We will matriculate our first class in fall 2023. We're a smaller class, so we've got 40 students who will be starting our cohort, and we plan on leaving it at 40 for at least the next 5 years or so, and then reevaluating from there. We are located in rural East Texas, so we're going to focus on rural medicine with a primary area focus of primary care. But looking at East Texas and looking at the needs, we need physicians from all different areas. And so no matter what specialty you want to go into, we're going to try our best to help you out any way we can. And so, yeah, we're very excited to start East Texas. That's one of the things we're looking for, is we're looking for physicians who want to stay here for medical school, hopefully residency, and then even hopefully staying here to practice, because we're seeing a physician shortage within rural areas of Texas.
Wonderful. Nicole?
Okay. So we, like Long and TCOM, we are a larger class as well. But I think what is really great about our program is, one, our culture. It's truly, although we have 240 students, it truly is a family. It does not feel that big. I feel like the majority of us in our office know most students by name. So I think, and the students really gravitate towards that. They're very supportive of one another. It is a very collaborative and supportive environment. We're in the Texas Medical Center, so our students get excellent clinical training. It's a great classroom for our students to be able to learn. They get to see a wide variety of cases and disease pathologies. And then I think another area that we're really proud of is our wellness and resilience program. So we are really concerned about giving our students the tools necessary to stay well throughout not only medical school, but then to have those skills to maintain their wellness and resilience throughout residency and beyond. And so that has been fully integrated into our curriculum the last 6, going on 7 years. And so we have a lot of longitudinal themes where we address all areas of your wellness. There's 6 components. I'll leave it at that and let Dr. Perry go.
All right.
Great, thank you. Absolutely excited to share information about the Foster School of Medicine. We were established as the first medical school on the US-Mexico border, and we're still continuing to be the only health sciences center that is located on the border. Because of that, cultural competency is really a big focus of our academic program. One of the unique aspects of our curriculum is that all of our medical students will be required to take Spanish while they're with us. We do have a certification program so that Spanish curriculum is tailored to everybody's proficiency level, and students are able to actually test to become certified translators while they're with us. They also will receive a certification at the end of our program. We also have a unique curriculum in that we have a clinical presentation-based integrated curriculum, which is a unique approach to teaching basic sciences integrated with clinical medicine. And we have very early clinical exposure. It's an important part of our curriculum. Another important thing is that we are a mid-sized school. We bring in a class size of about 125. And we start early. We have a summer immersion program where our incoming students will get to integrate into our community, get to know the various neighborhoods and be assigned to different neighborhoods so that they can start to understand and work with the future patients that they're going to be working with for the next 4 years. And that's really an important part of our institution is community service, service learning, and just giving back to an area that's supported us so much as an institution. So.
Wonderful. Thank you all so much for thoughtful responses there. I think if I were your chancellor, I'd be like, thumbs up. So for those of you watching right now, our panelists just shared where they're from. So if you wouldn't mind dropping in the chat where you're from, we'd love to kind of get a gauge for how many folks are watching us and from where. Dr. Kellaway, we did get a quick follow-up question about Long School of Medicine from Cody. Do students have the opportunity to work at the Brooke Army Medical Center if they're Long School of Medicine students?
Yes, thanks for bringing that up, Cody. San Antonio, Texas is Military City, USA. And we have even our civilian, all of us have a few military students in our classes, but even our civilian students get a chance to rotate at BAMC, the San Antonio Military Medical Center, and Wolford Hall, and a few others. So, and those rotations are really great. So, yes, thanks for asking.
Great. So we've got some responses. We've got a San Antonian, someone from Dallas, but currently in Colorado for school, Houston, Round Rock, Arlington, Tyler, Austin, but currently in Cleveland, so we're reaching cross-state lines, working for U of H in San Antonio, and Queens, New York.
Wow.
Awesome. Thank you all so much for joining us today.
Great.
So while we've done our introductions, we did get a couple of questions. I'm going to try to keep these grouped, so apologies if we don't get to your question. But we do have a follow-up. Let's see, which one do we tackle first? PK is wondering if applying to both an MD or DO and MD or DO PhD simultaneously or separately. I've gotten rejected from the MD PhD program to be considered after for the MD. So what does the process look like for those of you that offer MD, PhD, or DO PhD programs?
Well, I guess I'll start, but yeah, you can apply to both. And if you're considered for the DO PhD and you're not interviewed for that program, you'll be just considered, step back and be considered for the DO. Separately, you can actually, in our program, you can actually reapply. Let's say you enter as a medical student, as a DO student, you can turn around and reapply and during your second year of medical school, if you want to join the program again, showing us your qualifications through the first 2 years of med school.
Yeah, I'll second that. We have it's a separate application process, but we have a lot of students who dual apply. They apply to both the MD and the MD PhD. You can be considered for both. And same, we've had students who were accepted into the straight MD program, but after first or second year, sometimes even third year, they have applied for the PhD and been accepted into. So they've transitioned over.
Mhm.
All right. Thank you so much. Let's see. Still got a few more questions to get through here. That was around activities. We'll come back to that one. All right. So our next question here that we're going to bring up is around, applying early. We get this a lot. We do emphasize applying early is important, but I know a lot of folks are wondering how early is early, or what do you mean by that? So I'd like to offer y'all an opportunity to address that.
I'm going to briefly say early is great, but quality is important. And so if you need a little more time, then, to do some reflecting and have great descriptions in your activities and polish that personal statement one more time to really convey to us who you are and your passion and motivation, then take the time. We screen up until the very last interview day, and I think all my friends here do too. I mean, we're just all re-reviewing and re-reviewing and re-reviewing. So we'll find that excellent application.
Yeah, absolutely. And I can add to, I would say the majority of our interview slots are filled usually by early January. We interview into February. I would say usually by late December, early January, the majority of our slots are filled. However, we do continue to screen and we continue to send out invitations, and we always have cancellations too. So, yeah, I mean, I guess if you would think about what is early in terms of the application timeline, for us, it's more important if we're sending you out information or if we're sending out a secondary to you. I think it's kind of about the turnaround. So trying to get that secondary back within a couple weeks is a good, I think, plan for an applicant. But again, it's about quality. So at any point that we do get to your application, if it's a strong application, then you definitely have a shot. And another thing too is I think it's important to keep in mind is that we hold applications for our process to get screened until it's complete. And so that also is not just about your materials, but it also is letters of recommendation, which a lot of times holds up an application, and receiving MCAT scores, especially if you're scheduled to retake the exam.
Just to add a quick note, for applicants, once you hit the submit button, it'll actually take us at TMDSAS up to 4 weeks to transmit it and get it to the desks of our participating institutions. Remember that you can submit your TMDSAS application without an MCAT score and without letters of evaluation, and transcripts are not even required until we request them from you, or if you fit into one of our categories that we have outlined in the application guide. And so what you can do on your end to optimize the time is, it takes us a month to process your applications. It'll take the AAMC a month to get you your MCAT scores. So you can overlap that there. Or you can give that time to your evaluators to make sure that they put together a great letter for you and have all that packaged and ready to go by the time that your applications are transmitted to the schools. And just know that after submitting, there are still other aspects. From this group, how many of you all require a secondary application? And how many of you all require Casper? So there are still so many other things that you need to put together in order to make sure that your application is complete for that review process. All right, thank you. We've got a couple more questions. It looks like folks want to start getting into the activity section, so we'll just follow suit here. Number one from Cody: how do schools view military service? So there's a section in our application where we ask if there is military service. Some thumbs up, heads nodding.
For sure.
Yeah, that's a very big positive.
Positive, yeah, I agree.
And in the application, you do have an additional, I believe, 600 characters to talk about your military experience, how it relates to this profession. And also, if you'd like to upload your military transcript, it's completely optional, but if you'd like to give the schools a little bit of insight into what your training has looked like, that's an opportunity for you.
Could I add also, I really like to see when specific, if there were specific roles or responsibilities or duties that were assigned, if those are added under activities so that a little more detail can be provided, that's really helpful because like all of my colleagues indicated, we don't look at it simply as an employment position, right? We love to see the additional skills and experiences that you gain from that. So I think expanding on that, adding additional details on different maybe titles or positions that you had during that time period is really helpful.
Thank you. All right. Eric is asking whether schools would consider future activities more so than past activities. For example, they've just decided to pursue medicine and haven't had much experience in healthcare. So most of their activities might be under the planned category rather than under healthcare activities.
Might not be the best year to apply. You know, I think everything, everybody has plans for the future, but if a lot of your more valuable things, meaningful to you, are in the planned section, maybe you want to wait and do a growth year.
Thank you. This is a question we get often at TMDSAS. There's only a certain character count for activities, whether it be 300 characters or 500 characters as we've expanded several sections of the cycle. Do you all prefer to see activities structured in a certain way in the descriptions? I know in a previous panel, somebody asked if the schools would prefer a paragraph structure or a resume structure. Any preference for you all?
I don't have a particular preference, but one of the things, or paragraph to resume, but one of the things I've noticed lately, one of the things I would like to see is detail within the description. So if, let's say, for example, if you're shadowing a physician, tell us about who it is. Sometimes people will put down, I shadowed an anesthesiologist for 5 hours a week for 20 hours. Well, I don't know anything else. I don't know where. I don't know the anesthesiologist's name. I don't know anything, maybe what was going on. Just even a briefest description to know, give me some context. One of the other things, and this is just sort of the thing that's been popping up lately, and certainly my colleagues can jump on this too, is people are not even providing just sort of a descriptive of one part of that experience, like a little patient vignette, but they were in a room with a patient. I'm like, well, I don't know how much you were doing other than that. So you leave out even the basic facts. So, which makes it harder for us to understand what did you do in the totality of your experience. So, but be sure to put some of those details down. It reflects on your application that, one, you're attentive to those kinds of details, and two, it helps us really understand what's going on there.
Agree.
Yeah.
Thank you.
Can I add quickly? I think the best things to put in there, like don't waste 300 characters telling us what a scribe is. We all know what a scribe is. What did you get out of it? Lesson learned. What was the value for you in your journey, and what was meaningful? Those are great things to think about when you're writing those brief descriptions.
Yeah. Thank you. This is another question that we get very often. For what reason would an application be thrown out? And this is using applicant wording. We definitely would never use that on our end. We get this question enough that I thought I'd give you all an opportunity to address that.
I mean, I'll take a stab at, I don't know what they mean by thrown out. We review every application. So obviously if they weren't eligible for admission, meaning they don't have, they're not going to meet the minimum prerequisites. They're not taking the MCAT by the deadline. Their letters are never received. I mean, we wouldn't review it without their letters, but those are things, if you're not going to meet the admissions requirements by the time, you would start, that obviously you would not be eligible for admission. But I don't know what else to say about being thrown out.
Yeah.
I mean, I could talk about maybe red flags. I think many of us are very flexible in the types of experiences that candidates come in with, and understand that there's a lot of growth that happens, and mistakes can be made, and we can learn from those. We sometimes see applicants that may have had legal issues, or maybe a minor in possession or something like that. It's not uncommon. I think for us and others, I would assume the big thing is about lesson learned and the growth that came from those experiences. Taking ownership of mistakes that you've made also goes a long way. I think, if they're minor issues, a lot of times those are things that we are empathetic about, and understand that doesn't define you as an applicant, and there's always learning opportunities. So that's one of the questions that I get asked a lot. Is that something that's going to stop me from being able to be a physician in the future?
Yeah, I think you're touching on a great point there about holistic review. Just as one item or one bad point in an application won't automatically mean that it's thrown out, but rather the context of the full application. Right. And another thing I'd like to add to that is, if you're concerned about your application, I know we have a question here from Celeste. Should I not apply with a 508 MCAT, even if the rest of my application is pretty strong? I think these are the types of questions you should be discussing with your health professions advisor. They have a better context of your entire application. Our schools can't really look at a crystal ball and see how competitive this application cycle is going to be, or if there are other aspects of your application that may need to be strengthened. So to help you all, there is a link at the National Association of Health Professions, of Advisors for the Health Professions, and they have a database of all of the member schools across the country, and the health professions advisor at each of those schools. And if you currently do not have access to a health professions advisor, you can actually request to be paired with a volunteer advisor. So this is a wonderful resource for you all. I think we're getting a lot of questions around trying to figure out if you are eligible or if you should move forward with your application. But those are definitely questions you should ask a health professions advisor.
Yeah, well, it's an interesting question, because I don't be careful about the idea of not applying to someone because you low. Let us take care of that side, because it doesn't cost you any more to apply to different schools anyways than this application. So you might as well check all these boxes and let us figure it out on our end, because you might have a really good application that looks incredibly amazing, or have something in your background that we think you should have when you come here. We want you here. And well, meaning 508 is basically around the mean, so it doesn't matter to me at all. 508 is just fine. I've taken 502s, taken 498s, 499s. I mean, we have 520s in the class, so it comes from all different sizes, and I know these other schools do too. And we're interested. I mean, as a score to me would reflect reasonably that you would probably be successful in medical school. I mean, the hard part is the competitive part. With a 508, depends on how you fit into that, but it's not the end all be all. Now, a 486 is a problem. Well, it's just very competitive, and that's a hard score to get through with. But don't let it always discourage you about the MCAT. We have some great students that took the MCATs lots of times to finally get a pretty good score, good enough score, and they turn out to be graduating with honors. So but the number one thing was they were a great student.
Yeah, I think it goes back to that holistic admissions. I think we all do holistic admissions. And so an MCAT is maybe just part of the review, but it's not the entire review.
Excellent, thank you. I'm glad we recorded you all saying that, so now we can put that up on our website. All right. Dr. Perry mentioned some red flags, and now somebody's asking about green flags that you look for in an application. I love that our viewers are putting a positive spin on things.
One for me that I think work experience that shows maturity, especially if you've worked like in the food service industry, you can deal with all sorts of people. You're going to meet all sorts of individuals in your time as a physician, so you can handle people from all different backgrounds. So for us, I like to see previous work experience. That's a green flag in my opinion.
Mm-hmm.
For us, the green flags turn out to be things that were, I don't know, just like special in your journey that you should think about everything that you're doing and not leave anything out because you think it's small or not so valuable. But so it's as we read your story and then get into the personal biography, and you've done some interesting things and pursued some new adventures, or you're teaching yourself things. Those are things that are positive for us, as well as this. This is another big one too. Getting out of your comfort zone, getting to know the world and her people, and people who are not like you. So that's part of that getting out of the box thing. So so those are some positive things for us.
Yeah, I think for us, we like to look for somebody who's well-rounded. So somebody who has the academics, but also somebody who has worked in the community with healthcare activities or community service, leadership, things like that. And somebody who has shown being passionate for giving back to, especially to our rural region of East Texas.
Thank you. All right. Allison is asking, most of her activities are around specific fields since she's a neuroscience major. Would you all consider that putting her in a box rather than having a very diverse background?
I bet there are other things that you do, Allison, that you could put in other places, leadership skills that you've gained, or extracurricular, do you bake or craft or play the guitar? I bet it's not so unidimensional as you think.
Mm-hmm. It really could be exhibiting your passion for something.
Yeah.
Tell us your story, why you do that. Why did you spend that time there? Maybe there's something in your background that's not just academic, but related to that we might find really fascinating, or we see it as an expression of passion, interest. Some students come because maybe family has a disease in a particular loved one in a particular area, so they're very fascinated in cardio or neuro or diabetes endocrinology. So they're very passionate about those areas, and they spend a lot of time with them, which is okay. I mean, it's also, but I think they talked about the comfort zone. We want students that are willing to get outside that comfort zone as well. But if you haven't yet, but you're willing to do it, then we're of interest.
All right, we're going to get into one of the special populations that we often discuss as non-traditional students and applicants. Albert is currently a nurse. Are schools asking questions on why a physician versus a nurse practitioner? What do schools like to see? So this is a second career person. I think responses here would be really applicable to other non-traditional applicants.
I mean, I think as long as you explain in your personal statement why it is you're changing careers, and why medicine, that answers it. And they may ask on a interview why physician versus NP, but your personal statement should already address that, why it is you chose to go into medicine.
And it's also Nurses Appreciation Week, so we appreciate your effort. But we've had nurses come to medical school. And many times they have physicians they work with, and write just glowing recommendations as a part of that.
I could add, I think I would also just add quickly, and to add to what others have said is not just an explanation of why you want to switch, but what is it specifically about the role and responsibilities of a physician versus other healthcare professionals that interests you? Because I know many of our interviewers ask that question, why a physician, why not another position in healthcare? And so I think it's important to be able to differentiate and demonstrate that you have a good understanding of the differences in the responsibilities.
Great, thank you. We have another follow-up question around the activity section. When describing posters or presentations for the research activity section, what should they include in a description? What is it that you're looking for?
Besides the topic of the research, your role in the research, provide like Dr. Kennedy said before, provide a few details about that project itself.
Easy peasy, right? All right. Another population that we talk about often is our re-applicants, folks that have previously applied and had their applications sent to the schools. What do you look for in a successful re-applicant?
I'll take a stab at it. One, being a reapplicant is not a bad thing. There's just too many qualified applicants to all get accepted in a year. So sticking with it is a positive thing. We want to make sure that you have done self-reflection. You've looked at your application, where was the weakness in your application, and then what did you do to address that weakness and to bolster your application. So that's what we're looking for. You've done some reflection and insight into what it was.
We'll also want to see if you've kept up, for instance, with your extracurricular activities, healthcare activities, making sure you're keeping up with those. If you're doing a gap year or whatever the case may be, that you're not just sitting at home.
And if you don't know what to improve on, I think that's a great opportunity to reach out to your health professions advisor again. I know some of our schools offer some feedback sessions, but those are in the spring before the application begins. But at all times, your health professions advisor is going to be a great person to help you hone in on those areas for improvement. All right, if y'all don't mind me hijacking, maybe giving you a quick opportunity to take a quick sip of water. We've got a couple of questions around the application proper. I'm going to go through these pretty quickly. Should we still put parents' information if we file as independent on taxes? What difference does it make? Your parents' information is actually very important in the application because it gives the schools a context for the environment that you've grown up in, and actually comes into play a lot more than just determining whether or not you're dependent on them. So please do include them, especially if you claim your residency based off of your parents. We need to see that information in the application. And then Helen is asking about the English prerequisites. She never took an English class at the undergrad because it focused on non-science writing. Visit the TMDSAS website and look at the prerequisite coursework descriptions. We have several items or topics that need to be covered in the course in order for it to meet the prerequisites. And if you have any questions, every page of the application actually gives you a link to send us an instant message through the application portal. So that would be a better avenue for getting that question addressed. And then finally, from George, can you swap out letters of evaluation after submitting your application? Yes, you can. You can actually update that section yourself. But if we have received a letter from an evaluator, you will no longer be able to change that evaluator out. All right, enough hijacking there. For the schools, back to you all. Do you plan to continue virtual interviews or go to in-person interviews this cycle?
We're virtual with campus visits.
We're in person. We have in-person interviews.
We will be virtual with in-person visits as well.
We're virtual. You can come and visit though as well.
Yes, we have in-person second look visits, but everything's virtual.
All right, thank you. We've got a couple of questions around institutional action for poor grades. For Eamon, he's seen a strong upward trend in the last 90 credit hours, but still has that institutional action in the record. What is that going to look like in the review process?
Looks like you've got the hang of it. You know, we look at those trends, and I think it shows, you know, resilience. You've met that challenge and been successful more recently. So I think we'll all look at it as a positive thing.
And Cody has another question around Casper scores. How do you all take a look at those? Are you giving a percentile, but what are your schools looking for, particularly around Casper scores?
So we use Casper impressionistically. We don't use it as a cutoff or to screen out or to screen in. We mostly consider it after the interview, and we use it in our committee discussion. And again, it's just incorporated into the holistic overview of the applicant, typically after they've been interviewed. We don't have it formally incorporated into our screening process. That's us specifically.
We do pretty much the same thing as Dr. Perry described, with maybe one exception. Later, about mid-cycle, I would say, we've got lots and lots of Casper scores and people who may not have made it into the interview pool yet, but we see a very strong Casper that is measuring personal attributes that we all think are very important in a young person or a future physician. So you could get screened in on the basis of that, but we also use it impressionistically, and it's one of so many points that we see in the application when we're evaluating interviewees and applicants.
Okay. We still have about 15 minutes left in the session. We're going to be very respectful for your time because I know it's that time of the year for so many of you. Let's see which question. Something that hasn't been brought up yet, but is around the personal statements. What is the role for those, and how can applicants make sure that those are strong and effective in their favor?
One thing I like to think about with the personal statement is that we know you on paper for the most part, right? And so having your personal statement reflect who you are and your goals. You can talk about what you've overcome, how you've overcome them, what your future plans are, things like that. Just having a good picture of who you are as an applicant, as a student. Because like I said, all we know is what we have on paper for the most part.
Tell us stories about your encounters. Tell us about helping somebody in community service or learning from a physician in, a healthcare experience and things like that. So tell us some stories.
Sort of let us know why you want to go to medical school. What is it about it? And that's where you talk about those stories that may have influenced you. And, take your time with this. This is an important question. So for our committee to sit down and look, and they want to see how it looks compared to the rest of your application. What you say and what you do, how did they match up?
I agree. Why specifically medicine? Don't just say you want to help people. You can help people in any career. So why medicine? How have your experiences so far prepared you for medical school so that we know, what your background is, who you are, and who you'll be as a future student and future physician.
So in short, answer the prompt.
Yeah.
All right. This is a great question here. If you could go back and change one thing you did on your own medical school application, what would you change or improve? I think Dr. Calloway, this is going to be one for you.
Oh, I would have changed so much. I would have listened to all of this advice, which is really why I love helping pre-meds. It was a struggle. It was an academic struggle as a career changer, and to learn how to do a multiple choice test and physics and OChem and all that. What would I would have given it a lot more like proactive thought. I would, go. The academic thing was one thing, but I would have prepared better for the MCAT, knowing that it was really those study skills were really going to help me along the path in the future. So many things I would have changed. So, but now I get to tell pre-meds, advice from a source.
Well, thank you. I'm sorry we put you on the spot there.
No, it's okay.
Eamon's asking if there are any of your curricula that allow for out-of-country rotations.
Yes.
There was another question along the same lines from Anusha. Are there any global health ventures that your programs provide?
Yes.
Yes.
We have distinction programs, so you can go on one mission trip with a group, or you can hop on to something, or you can plan a project by yourself or with a group of students and have faculty mentors and go put some good in the world around the world. So, and it's an MD. Then your MD says with distinction in global health.
Yeah.
Same. We have a scholarly concentration in global health. We also have student organizations that do global health. You don't have to leave Texas to do global health work either. So lots of opportunities.
All right. And Helen is coming back to our essays. Are there any big no-nos for the optional essay? So this is your opportunity to address something that isn't addressed elsewhere in your application. Have you seen other no-nos? And Dr. Perry's smiling, so I think she might have something for us.
I would just say skipping it.
Mm-hmm.
I always tell everyone optional is not optional. If you're passionate about this, if you've been doing the work and have been committed, you should have so much that you want to tell us. And you have such a limited opportunity to really show us who you are and what you bring to the table. And so take advantage of every word count and character count that there is, and let us know why we need you at our school.
I'd love to ask everybody here, because I've heard some differing opinions on the use of that optional essay to explain grades or explain MCATs or academic things that we, little missteps that we see. I think we figure it out, like Eamon's upward trend. So I think you have to be so careful not to make it sound like an excuse, But I'd love to hear what other people say about using that optional essay to explain a bad semester or something.
Well, I think sometimes you do. It helps just knowing sometimes it doesn't mean the semester, it's just one grade. We're trying to figure out where did it come from, because it leads us to question, was it a conduct issue that got you that bad grade, or was it just I failed the course because I stunk at the topic, and you had to retake it? And that happens. I mean, and what did you do? What did you learn from that? What did you do differently to be successful? And that's a learning. How many times can we, and all of us on this call could say, we've run into an applicant who learned how to succeed after failing, and it's an important attribute. To learn from your mistakes, and that's okay. And, but you can also talk about an experience. I know the application's longer and every year we always sit down and look at these questions and go, what more can we ask you? But we can't figure out everything, and those optional prompts may give you that opportunity to talk about something wasn't addressed anywhere else. It just didn't fit. And we might find it really fascinating. Don't make it a continuation, though, of your primary essay. It seemed like it just kept going from your previous one. That doesn't really work well.
Dr. Kellaway, I will say sometimes it is helpful. Like I'm thinking of a specific student, they had a lower GPA. Their academic road bump was longer than you would have expected, but they were phenomenal in all other areas, had a solid MCAT score, and they did use it to explain they had been a student athlete, they played lacrosse, and they had a concussion, which it went undiagnosed for a while, which had affected their academic record. So then obviously we were able to look beyond, because the GPA did persist for a while. So I think in those cases where it's unique or there's a certain explanation as to why it's not just a one-off, then it's certainly helpful to use the optional essay to explain that.
Mhm.
I think this was mentioned earlier. If you are using the optional essay to talk about grades, don't blame, oh, I had a horrible teacher, they just didn't know how to teach. Take some ownership of it, explain really what happened and what you learned from it, and how, like if you did retake the class, say you went from a D to a A or a B, you can talk about what you did differently within yourself to make a better grade and to have a better outcome. But I like what Dr. Perry said too. It's not really optional.
Yeah. All right. So this will be the last question we take from those watching. This is from McKenna, and she's asking a great question. She's struggling to get a hold of her LOR writers from last year. Is it advised to use a different person to write a letter rather than having a letter that's 1 year old? So in our application, we do encourage applicants to use letters that have been written within the past year, but this, obviously you can send in whichever letters you'd like, as far back as you'd like, and we do mention that the schools do prefer letters that are written in the past year, but unfortunately there are some folks that can't get a hold of anybody else. So what feedback do you have about folks who may use letters more than a year old, and maybe if you have some advice from McKenna?
I think it's okay. I think if it's someone who has, who knows you well and knows you well in recent, times, then I think that that's fine. A lot of us have ways that you can add additional letters also. So.
All right, group consensus on that. All right, we've got about 5 minutes left in this session. So I wanted to tackle this question. Oh, not that one, because that's for dental applicants. When approaching medical schools and which schools folks should apply to, what factors should they be considering? I know we've mentioned mission fit throughout and kind of alluded to it, the core competencies, we've alluded to those. What kind of factors should an applicant be holding as they're applying to different schools and then going to interviews, exploring and seeing whether they would be a good fit for the school?
Do your research. Kind of some of the things we've talked about. Review the school's website, look at their mission, vision, and values, see if that aligns to what you want to do upon graduating is really important. Don't just assume that we're all the same, because even in our little elevator speech earlier, we were talking about some of our differences. So don't assume we're all the same. So do your research.
And I would say it's curious. So, it's competitive. When you're selecting fewer schools than the one fee for, what are we, 13 now? Have some method in mind. I always have a little wonder if people have a selection of schools and are not opening themselves up to others because I believe you should like find out about all and not be too selective because it's a competitive process.
Well, I kind of sometimes tease when I do a presentation to applicants. I tell them there's over 2,000 seats in the state of Texas between all these schools and TMDSAS. So if you unselect one box, you're taking all those seats and opportunities away from yourself.
Yeah.
So do you want to? But, I think Amanda brings up a good point about Tyler. Tyler's very specifically focused on something, and whether they have wiggle room on their selection of students, I can't speak to that. But RGV has sort of a mission too. El Paso is going to have a mission as well, and San Antonio. Our mission's a little different. I mean, we're promoting a profession as much as we are promoting medicine itself as a field. So we have people. We want people that are interested in this distinction. But I would keep some things out. Texas has a lot of great medical schools. You can't beat the deal that you have in this state compared to around the country. So take advantage of that opportunity if you're a Texas resident, especially.
All right. I said that we would take that last question would be the last one we took, but Cody brought up a great one. For out-of-state students, do you look for strong connections or ties to Texas? I know this is a commonly asked question from our out-of-state applicants. How do you assess those?
I think it's nice to have ties, but we end up every year having out-of-staters who come to Texas and end up loving it. And so I think it's a plus. But if you don't have ties for our school, it's not necessarily a negative thing, because you're going to love it here.
Right.
Yep.
Yeah, for us, we specifically look for geographic ties to a region. But if a student doesn't, you can also talk about why are you interested in coming to the region. Do you have connections with another area that's similar to East Texas, something like that? And so just talk about why do you want to come to Texas versus a different state or where you're from. And then do you have any regional based on demographics or health disparities or whatever, or rural communities, whatever the case may be.
So having a photo with a 10-gallon hat is not enough. All right. Well, we've reached the end of our session here. I'd like to thank each of you for your time once again. Is there anything that you'd like to share with our prospective applicants here? Any words of wisdom or encouragement, inspiration?
Keep up the good work. It's hard. We all recognize that, and just you'll have little trips along the way, little falls. Just get up and find your passion again, and find your motivation, and keep going.
Yeah. Thank you. That's a great note to end on. Well, once again, thank you all so much for your time joining us today. And on behalf of TMDSAS, the Texas Health Education Service, and our member institutions joining us today, we'd like to wish all of you all the best of luck, and just know that the help is there whenever you need it. We're ready to help you. Thank you very much, and we'll see you next Tuesday during our first office hours of the cycle. See you then.